So this is my diagram of the heart. This is the whole system, and I'm going to be explaining the different parts of the system and how blood travels through the entire heart. So blood comes in through the upper half of the body, which is like the head and the arms, and the lower half of the body, which is like the legs and the organs. So the upper half of the body, that blood will travel through this superior vena cava, and through the superior vena cava into the right atrium. Now the lower half of the body will also travel to the right atrium, but through the inferior vena cava. So it'll go up through the inferior vena cava into the right atrium. The right atrium is the first chamber. So there are 4 chambers in total. The blood that has entered the right atrium is deoxygenated blood. So the role of the right atrium is to empty the deoxygenated blood into the right ventricle, which is this next chamber. The deoxygenated blood has to first pass through the tricuspid valve, which is this valve right here. So this right atrium will fill up with blood and then will contract, pushing the blood through the tricuspid valve into the right ventricle. So once the blood is in the right ventricle, it has to pass through the pulmonary valve right here. This is the next valve. This valve allows the blood from the right ventricle to pass through into the pulmonary artery, which is this right here. So the blood passes through the pulmonary valve into the pulmonary artery, which is then branches off into 2, going out this way into the right lung, and then going out this way into the left lung. So the blood going out is deoxygenated blood, so this is CO2. But now we want it into oxygen, which is just O2. So it goes into the lungs and then comes back in through the pulmonary veins, which are right here and right here and right there and right here. And both of these sets of veins come into and join up through the veins into the left atrium, which is this part right here. So once it's in the left atrium, it is now oxygenated blood. The left atrium is the receiver of the oxygenated blood from both sides of the pulmonary veins. So the blood will now go through the mitral valve, which is right here. And the function of this is the same as the other valves to prevent backflow of the blood. And it will open up like this, and the blood will now travel into the left ventricle, which is the 4th chamber. Once the blood is in the 4th chamber, or the left ventricle, it can go through the aortic valve right here. This is the last valve as well, and this has the same function as the other valves. It will allow the other blood to flow through the valve without it backflowing the wrong way, and this blood is oxygenated, and it will go into the aorta right here. This is a giant artery which will push the blood out through the aorta into the rest of the body. So it will go into the legs and the organs, and this will go maybe into the arms. This can go into the head and the brain, and will send oxygenated blood throughout the whole entire body. So I just want to talk a little bit more about the valves. All the valves have a very important purpose. As I explained before in the video, they prevent backflow in the heart and its system, so then it doesn't get all clogged up. So basically, the left ventricle right here and the right ventricle right here, they contract, and the pulmonary valve, which is this one right here, and the aortic valve, which is this one right here, are then open. So these ones are open, and this is called cyaocily. When these ones are open, the tricuspid valve right here, this one is actually closed, and same with the mitral valve. This one's also closed. So when these ones are open, these ones are closed, and then the blood is pushed through into the right ventricle or no, not the right ventricle, the pulmonary artery and the aorta. But then when those ones are closed, these ones right here, and this one right here, when these are closed, these ones open up, and this is called diastole. So these ones open up, and these ones are closed. And then the blood can now flow through here and here. So the snapping, closed, and the opening of the valves make the sound of the heartbeat. So the snapping and closing are so powerful that you can actually hear it outside of the body. So one disease or condition that can happen in the heart is called mitral valve prolapse. This is when the mitral valves have overstretched or have extra tissue or a bulge. Usually, the valves will have to close tightly once blood is passed through them. So from the left atrium into the left ventricle, the mitral valves are supposed to close tightly. But this condition has made it so there's a tiny gap where blood can flow back into the left atrium. This can cause chest pains or tiredness. Isn't usually deadly, but you have to go see the doctor if you have experienced serious chest pains, which means that there's a lot of blood flowing back into the left atrium. Another condition that can take place in your heart is called pulmonary embolism. This is when your pulmonary artery right here has a blood clot in it. So the blood is supposed to be flowing through the pulmonary artery into the lungs and then to get oxygen for the heart so it can spread it to the rest of the body. But when there's a clot, it prevents the blood to receive that oxygen and going back into your heart. This can cause a lot of problems for the body because the lack of the oxygen it's getting, and it can even cause death.